celebration and experiences talking about transition of healthcare from pediatrics to adults. Mr. Ruben Buford is with us, and I'd like for you to share. Well, first, thank you for agreeing to participate in
Of
our
course,
discussion.
of course.
And then if you'll just share a little bit about your life. How did you grow up living with sickle cell disease?
Well, thank you. My name is Ruben Buford III. I am the youngest of three children. Um, I was born back in 1968 when there were no testing for sickle cell disease during that time. Um, my first experience that I can remember being told, I was about 2 years old when I actually had my very first crisis. My my mom and dad wasn't quite sure what was happening. It happened early on, about 6 months, when I first started having issues with pain. But at 6 months, no one can really know what was actually happening. It wasn't until I was two when I was actually diagnosed. Um, my whole life has been a roller coaster, as I would normally say. But it was a good roller coaster. I'll put it like that. Uh, I was told by my parents, which are no longer here anymore, that I would live to be between the ages of 9 and 12. And hearing that from them, I guess that was a motivator for me to make me want to do more with life, especially if it's going to be cut short. And here I sit today at 54. So I think there are some things that God has some plans for me. You know, I still got work to do, so that's why I'm still here. I remember a lot of the things that I had, my crisis as a child. Uh, it was kind of difficult, uh, not really having a clear understanding of what I was dealing with. And it kind of shut me down for a little bit. But as I grew a little older, I say I was about 10 or 11, I got this thing in my mind, well, I'm not going to be here much longer, so I'm going to do everything that they said that I wasn't going to be able to do. So that's when I started with sports. I started with band, and my mind was made up. I think around 12, I said I was going to be this engineer, and I did graduate with my mechanical engineering degree from South Carolina State University. So uh, it was tough, I guess, as a young man with sickle, dealing with crises, and then everyone is trying to figure out what's happening with you, your peers. I would put it like that. I think I was at a point where I was quite ashamed of what was happening at one point, and then that switch came on. It was you had no choice in what you're dealing with. So you're dealing with a genetic disorder. There's nothing that you caught or nothing that you caused on yourself. I'll put it like that. And once I realized that, I said, well, it's time for me to start digging. I really have to figure out how I can live past this time that everybody said, well, you're not supposed to live up to. And that's when I started educating myself on whatever it is that I needed to do. My parents both finished high school, but everyone didn't go on to college where they can, get the degrees to understand a lot more about what their child was dealing with. They were just trying to make sure that we had food on the table, clothes on our backs, and a roof over our head. That was the key thing I think my parents was focused on, and making sure that I had the best care possible. A lot of parents today may not be able to do a lot of those things, but I thank mine, for all that they did by pouring into me. It's not me, but me and my sisters as well. 'cause my sisters actually have the trait. Um, I ended up with full-blown sickle, so. But to look at me, I've listened to all the discussions we've had today, and everyone would be like, well, he does not look like the average sickle cell patient, right? Uh, I'm not going to let anybody tell me what I should look like, if that makes sense to you. I'm not going to let anyone tell me how I should live or, what I can't do. I had to learn some of my limitations coming up. And once I realized them, then I made a conscious decision. I always tell my wife, I said, well, I think I got some sense when I was about 22. There are certain things that I know that I can't do, and I'll actually have to just slow down and start doing things a little different. Um, Educating my family as a whole, not just my wife, but my children as well, I believe is key. So that they'll have a understanding of what dad is going through, when he's going through them. The tough part that I experienced, I believe, is when I had to stop work. When you're the breadwinner, the person who actually do a lot of the things for the family and not just your own, but everybody else, that was a very difficult time for me. And I said, well, I made all of these accomplishments. I went to school. I lived different places. I started my own business at one point. And then now I have to give it all up because of the issues that I'm having with my health. Um, I said, well, I think it was about 2 months, 3 months in. And I was like, you know what? I'm going to homeschool my kids. I said, well, that will be the thing that keeps me going. And I started homeschooling. I homeschooled my son from 6th through 12th. And once we finished with him, we actually moved here in 2014, moved back home. And our daughter, she was going to 10th grade then, and she said, well, she wanted to go back. So I said, okay, we'll let you go. But we wanted to make sure that they had the best as well, as far as education wise, because I didn't want them to ever feel as if they needed to sacrifice a lot of the things that I had to sacrifice, my time, being in the hospital, um, dealing with the pain crises. It has been taxing. I'll put it like that. It has been taxing, but it has also been a motivator for me. So I hope I gave you a little bit. I can go on all day, but
You certainly have. You have shared your amazing spirit and motivation,
yes,
which we need you to talk to our patients, our young patients and
of
young
course.
teens who some are having a hard time dealing with living with a chronic condition like sickle cell. I wondered about your childhood friends. Did you want your friends to know you had sickle disease?
No, ma'am.
Didn't want them to know.
I did not want to. I just wanted them to think that I was just as normal as they were. I didn't have anything that would hinder me from doing, any and everything that everybody else was doing.
Did you know any other patients, children that were patients?
I knew two more that were at school with me. One was a relative of mine, and one was a classmate of mine. Um,
You
other,
all knew each other had a chronic condition.
we knew each other
You
had
all
it,
knew,
yes,
but the rest of your
but
classmates didn't.
no one really ever had the opportunity to know like that. They found out, I guess, from me missing school for an extended period of time, being hospitalized. Uh, I believe that was when the light switch came on for a lot of them, and they started to not treat you different, but horseplay became less with me and some of the other ones than with the rest of the classes, you know. I think a lot of times when people realize that you have an actual condition, they'll want to treat you a little different. I didn't want to be treated different, you know. So I think that was part of it. Uh, Not ashamed, but just not wanting everybody to know what was happening because I didn't want to be treated different. Just treat me the same as you would treat anybody else, you know.
And as far as your medical care was concerned at that time, childhood years, I would think we should mention that you had episodes of illness as young as 6 months, even before we knew,
Yes,
your
ma'am.
family knew that you had sickle disease, and that was typical of the time.
Right.
Again, the reason for newborn screening is many children were sick and weren't diagnosed until they were older. Some didn't survive even past the infancy age.
Yes, yes, yes.
So, but your care, your medical care was
It was it was uh for that time, I believe it was good. Um,
when you had pain, you were treated with,
See, I have
don't
no
know
idea.
exactly what
I have no
treatment
idea what the
was.
treatment plan was. Not at 6 months, 2 years,
Mhm.
but I remember around 10. I remember when they used to, you know, put me in the hospital. I would go in with the fevers, like we discussed earlier. Um, I had this doctor. Uh, he was in Mount Pleasant, Dr. Otis Pickett, um, and he made sure that I had my antibiotics, and he made sure that my mom or my dad knew to make sure that I actually had my liquids, my fluid, they hydrate. You have to hydrate them. You have to hydrate. That was the thing that everyone was talking about back then. Hydrating, Tylenol, and making sure that he didn't get any sorts of infection. So that's what I remembered as a child. Um, as I got a little older, I think that's when Dr. Brunson came on the scene and she explained things a little bit better to me about Ruben, you have to do this, you have to do that. When you're tired, because I marched on the marching band of South Carolina State. If you get overheated, you need to stop. My band director, he understood that, but I would still push because I didn't want to be treated any differently. You know, I just wanted to make sure that I did the things that would be able to keep me around, do the things that I had pleasure in doing. My doctors back then, I believe they did the best that they could have during that time when I was a kid, especially when I didn't understand it. So I know that their ages are, 16, 15, around that age here. I actually believe that we should go a little younger than that, if possible.
Certainly, certainly. Many of our specialists have explained in their experience that introducing the concept of transition and moving to your adult years, we have to start giving the 12-year-old, 13-year-old chance to learn about the disease. Again, it's left to the parents. All the discussions are directed to the parents,
Right.
and and then all of a sudden we say, "Oh, you're 18 now. You need to go over to the adult side."
Mm-hmm.
But many times there's not been the preparation that we've mentioned this morning as far as stepwise education and transferring the responsibility over to the child. You have an independent spirit about you that was already showing up when you were a teenager and gave you the motivation. But were you ready to move to an adult practice when you were how old were you when you started seeing?
I believe I was actually 21, I think, around that age. I knew because once I got cut off from pediatrics at 18, I still had my primary doctor, Dr. Pickett, at that time. So for everything, I just went to him. You know, I think that was the thing that made me uh, more conscious of how to do certain things. I think that was another key element in making sure that I was able to uh, follow the rules or guidelines that were already put in place. Uh, I said I didn't get an opportunity to meet you as a child coming through, but I did run across some good doctors at one point that made sure that was, making sure that I did have the care that I needed. Um,
It wasn't considered transition, but it wasn't called transition.
no, it was not definitely not called transition back then. No, no, ma'am.
Did you feel like your primary provider prepared you to be able to be? So
Yes,
in addition to Dr. Brunson, did you have an adult primary doctor?
yes, that was Dr. Otis Pickett.
That was Dr.
Yes, yes, ma'am.
And you saw that doctor as primary, came to Dr. Brunson for specialty.
For hematology. Yes. Mhm.
Okay.
Okay. Oh, how's that?
Okay.
Okay.
So with your experiences with Dr. Brunson, can you share with us a little bit about what is different when a hematologist cares for you or is involved in your care?
Well, she explained sickle cell to the letter. She told me what it was, what it could do, what it will do, and how to maintain. I think all of that should be taught at an early age. Um, Pediatric care is great. That's awesome. But once you reach a certain age, we have to have that to follow through. There are a lot of us that did not live to be a certain age. And then, as we stated earlier, you all stated earlier, people with sickle cell are living much, much longer now because of the care, because of the medical advancements. But I still understand, oh, I need to understand this. Maybe you can help me with this part. Uh, Certain care that I receive now, I wasn't afforded that care early on. So there are things that I honestly believe that we can do, or no, these are things that we should do that actually could have avoided a lot of the issues that I believe that I'm having today. To look at me, I look like the healthy person. I've been in heart failure. I have pulmonary hypertension, which are all things because of sickle.
Process.
I actually have been dealing with kidneys, issues with my kidneys. They work sometimes, sometimes they don't. And no one can actually explain to me exactly why it's happening. I was hospitalized back in November of last year, November 30th. And they told me that my kidney function was like zero. And I got my port put in my neck because they thought they would have to do dialysis. 2 days later, they were taking the port out. So I've had that experience once, I believe, some years ago. My wife went into surgery in about 10, 15 years ago, I believe. And the same thing actually happened, but no one can ever explain it. And I was in a mild crisis during that time when it happened. So they tried to put the two together and said, well, maybe because he was in a crisis, maybe that's what happened with him. Uh, I now take every 4 weeks, I go in for hemopheresis. That has been key because I develop iron overload from getting the transfusions over and over and over and over again. The years of that started to damage my liver, my heart. You know what iron overload can do. I tried every med that was on the market, XJ, everything that they told me, well, Ruben, you need to do this to get rid of iron overload. Um, I said, okay, I'll try it. Whatever you ask me to do, I'll try it. Uh, but if hemopheresis can take my iron overload from 9,000 to down to what, 200 and something now, uh, why couldn't I just have that in the very beginning? And I think it was like, well, what was explained to me is because certain things had to have happened to me first before I would have that opportunity to have that. And if you're going to have sickle patients here that actually have that opportunity to not have to go through that, then why not just give them that opportunity in the very beginning? It's I know it's a cost thing. Like you were talking about, Cromwell was talking about the cost for everything. What's the cost of life? And I need some people to actually explain that. Not you per se, but the higher ups to explain what's the value of human life when it comes down to the care. We throw money at everything else, but when it comes down to sickle, it's like you get the bare minimum. It's not like anyone asked for this, um, but everybody does not ask for cancer. But when you have patients that have cancer, you got everything, every avenue is open up for them to have that, or different diseases. I'm not just singling out one. But when it comes down to sickle disease, it's like, well, if it's not affecting me, then it's not important. And I don't think that's fair.
You're expressing a very common sentiment among our patients and families, and that is it's the reason not much research had been done in sickle cell disease over the years. Even though the science was there, we knew about the mutation, there wasn't an effort to make clinical management better, to make patients' lives better. And it's because the condition affects a minority population. We are minorities, and the emphasis was not on interest in research for our patients and for us. That's changing, and that's the bit of progress that we can talk about and support and cheer that there is interest. And that's why I mentioned the three medications just approved in the last 3 years
Right.
are a new option for our patients. We don't have time to go into it today, but just a lot of parents ask us about why isn't my child getting transfusions every month like my neighbor or my relative's child? Those are the patients who are not complaining about pain. They're happy, they're growing, they have good appetites, but the indications for transfusion are specific and defined. And the majority of times in our patients, we're using them for patients who've had a stroke.
Mm-hmm.
And we're talking about a lifetime of transfusions. The rest of the patients may need an intermittent transfusion. And I think if you were in that group,
Mm-hmm.
that you had a low hemoglobin for a period and needed a transfusion, but it still was cumulative. The iron continued to build up over the years and then and damaging your organs, just as you described, your heart, your liver, your kidneys. And The oral chelators, the oral medications to pull off iron, were being developed. Everything in medicine goes through a 20-year period. Find a medicine, test it, and prove that it works and it doesn't harm. And so by the time those medicines were available, you were already overloaded with iron. Pheresis technique, which is a mechanical transfusion on a machine where we take blood out and in, that technique, like dialysis sort of, that technology took some time to come about, so that we don't want to say we're not being offered with those, we're not we're not being offered with those technologies, those interventions on purpose, but it is a gradual improvement in care that we can offer. And it's wonderful that you are able to have pheresis now. Other complications limit what we can do when the blood supply is short. We can't do pheresis as easily. We resort to the simple transfusions, but but you're right. In the long run, some interventions are beneficial and would have prevented other complications had we used them or had they been available early in a patient's life. I do want to mention one thing, and that is just listening to Mr. Buford, we are reminded of how different each patient with sickle disease can be affected. All the patients have sickle disease, but the spectrum is broad as far as some patients very sickly at 6 months of age, and then their whole lives they're sickly. And then others, 18, 19-year-olds, some have never had a pain episode.
Right.
And they don't even know what we're talking about when we say bone pain and joint pain and chest syndrome. And so, and the majority of patients are in the middle. They're having pain sometimes, but many are able to still function and be very healthy and have quality lives. But your experience points out the longevity, first of all, that you've lived so long, and yet you've still been able to manage the complications that we anticipate come from silent sickling for 20 years, 30 years. But the evidence of the sickling shows up as the complications that you're talking about today. I hope that offering our patients, we can give hydroxyurea to babies 9 months old, starting at 9 months. And if they take that medicine their whole lives, we are hoping they won't have renal failure. They won't have pulmonary hypertension. They won't have a stroke. And that's what we're living now. We're living to see if we use these interventions, will they change the course of disease in our patients that are young and children right now? Um, did you feel prepared to be an adult patient?
I believe I
You took
was.
responsibility for your health care, you're making appointments.
Yes, ma'am.
Did your parents go with you to the ER as an adult,
Most of
young
my
adult, college student?
most of that time, no, because I was actually away from home.
Okay.
I wasn't actually at home. But if I was hospitalized, they would always come to wherever I was. That was key. I think that helped me to even want to fight a little bit more.
Okay.
I've known a lot of people that actually, because of an illness, just give up on life. You have to have a spirit within you uh, to want to strive and always do good. I think being told certain things early on was my trigger to say, well, I will beat this at all costs. I will do whatever it is that I have to do. So I sit and I listen to my doctors. That was key. Um, you have to find, this is for parents and fellow sickle cell patients. You have to find a great team. You have to find that team. Everybody is not going to be on that team with you. I had a doctor at one point, um, my primary, when I was living away, actually sent me to this doctor. And he actually made a statement about the issues that I was dealing with, not knowing my background. And it was like, it's your fault because of this, this, and this, because that's when they were telling me about my heart. And that was my first and my last time dealing with him. That,
You had the option. You were able to get another doctor
oh, you only get one time to,
with you.
yeah.
Okay.
uh, I'll give you an opportunity. I'll hear you out. But it was some years later that I was on a panel discussion and he was on the same panel. And he actually, after we had our discussion, he apologized because he did not know. And when you're dealing with different doctors, uh, I honestly believe they have to have an ear to hear the patient. And you got to have a heart for people. Just because you have a job that you do, you actually have to have a heart for the people that you're dealing with. And I picked that up. It was a job for him. He didn't have passion about it.
But he
So
recognized enough after dealing with you. He recognized enough to apologize to you
yeah, it was some years later, but
some
he
years
did.
later.
Yeah,
Okay.
because we ended up on the same panel, like a discussion. We was at a church and they had this thing going, a health fair type deal, and I was introduced and I told some of the struggles that I've had in life. And he didn't really read my history to know what my struggles were. And he remembered me from the conversation we had. And I'm like, well, I got to find somebody that's going to be more into what I'm dealing with versus, right.
Absolutely.
Yeah. I don't knock people for what they do, but I honestly believe if I put passion in something, then I think you should have some sort of drive to do the same thing. I'm not getting paid for it. You are. You know?
At what age? You mentioned keep saying earlier. We should start earlier with education and developing responsibility. Um,
I think
how early is early?
birth for the parents, because they have to have a clear understanding of what these things may come if
Yeah.
they're not dealt with, if they're not taken care of, uh, if they're not treated, if they don't get the care that they really need early on. Um, the child, when he's old enough to really understand or get a grasp, if he have that first crisis at 5, then you need to be talking to him about what actually happened with him. You
It's
know,
interesting because I would guess most parents don't talk about it.
mm-mm.
The concentration is just on getting you feeling better, take pain medicine to feel better, but not talk about why or how that pain episode developed. And maybe sometimes they don't say you might have another episode next week or next month. None of us can predict. But the other point is once the parents realize their child, if you're going to be in that, whichever group you're in, some are in that asymptomatic group, haven't had pain
Mm-hmm.
ever or not very much. The ones that are in the middle that have pain off and on periodically. But I think if the parents, just as you're saying, the parents engage the child to explain what's happening, why it's happening, and then can we anticipate when it might happen again? We've heard from Ms. Cromwell's presentation about the triggers or causes of sickle cell pain. And
Correct.
in Charleston, the weather in the winter months and
Mhm.
rainy weather, we know are causes. And even some are surprised to learn that now that it's 90 degrees every day, but when you go to the beach or you get in the swimming pool, the water temperature is not warm enough yet. And that triggers pain in many of our patients the first time they go to the beach, the first time they're in the water.
Mhm.
And but if the parent remembers that, then we'll say next summer, got to wait until mid-June, early July before we get in the water. It might trigger a pain episode. It's that kind of paying attention and involvement from the families, parents, caregivers that can help a younger child understand this is what I need to do to take care of myself. This is why I'm drinking water. This is if there's an interchange, and not just let it be, oh, the only time my mom talks to me is when I tell her I'm hurting and I have to get pain medicine.
Right.
They don't talk about the disease any other time except then. When the patients come to clinic, I try to do the education, but I think about it, I'm talking to the parents
Mhm.
mostly. And then when we started our intervention for transition, those patients are about 15. And so that's still too late.
Right.
And when we back it up to 12 and early adolescence, um, they're not, they may not be interested, but we have to bring the focus to you're a young teenager, you're going to be an adult shortly, and we have to introduce these concepts and get you interested. The fact that we have technology now has made a difference in the opportunity to learn and the mechanism to be able to learn. I was just curious, when you were growing up, how did you learn about the complications of sickle disease?
I actually spoke with my doctors.
Doctors told
Yes, ma'am.
you and did that education and teaching.
Yes, ma'am.
Okay.
It was, I guess, on the level where I could understand at that time. And as I got older, I knew I was able to ask different
You
questions.
could ask the questions yourself to generate those discussions.
Right.
And so that's always important.
Anything can be explained um, at any level.
Yes.
As Cromwell said, we got to reach people where they are. Uh, I believe that if we put the time in, you can reach a 5-year-old. You can reach a 2-year-old. They may not understand the pain aspect of it, but you teach them how to be potty trained, so you can teach them how to do some other things at 2.
Certainly.
Um,
They're all swiping their little
tablets,
tablets,
yeah.
2-year-olds. And I mean paying attention and just swiping right along and tapping the X to close out a screen and
So they can be educated on
they
sickle.
absolutely. It's 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 a matter of making that the focus
Yes.
and trying to introduce these concepts.
I mean, we can do if we can do it for anything else, then I don't see why this couldn't be this might be something for someone to come up with. Um, just make it where they can understand it. Um, Stroke patients have this book that has pictures. If they can't speak it, they can point to it. Um, if that's something that they can put on the tablet for a kid that's actually in crisis and saying what's hurting, you can ask, they can understand that. They may not be able to tell you what it is, but they can point to it and say, this is how I'm feeling. Um, I think back to the time when my father used to come in and my mom was like, Ruben, he don't want to eat. He don't want to do this. He doesn't want to do that. All I really wanted was silence, quiet. If I can get that, while I'm in crisis, that helps because I have to be mentally prepared for what I'm dealing with. And I don't think that a lot of times people understand that side of it. Um, so a kid that's not able to be able to explain, well, I don't need y'all to pick at me. I just need y'all to leave me alone for a little bit. Let me deal with what I'm dealing with. If we can find a way for them to be able to explain that. Coming up, I have to say this if you don't mind. Um,
Yeah.
I actually thought that I was going to die early, and I didn't want to do that because I thought I still had so much more that was needed to be done. So when my mom would always try to, well, Ruben, don't do this, don't do that. Mama, listen, let me live, let me do what I feel like I need to do. I didn't understand it then, but I really understand it now. It is for what I'm doing right now. It was to give me a little bit more strength to be able to talk to people just in general. You know, a lot of times we want to baby our kids, but we have to let them live. We have to let them do their things in life. Um, you may not understand it, but that child may understand what he's here for. Um, I honestly believe that if we take the time out and just listen to each other, a lot more can be accomplished.
I was wondering if Mrs. Cromwell would comment that the parents, are they smothering the children, or are they, and this is often when they're afraid that my child is in pain and I'm not going to recognize they're in pain, or I've heard about the complications that can happen. I want to do everything I can to keep those from happening, but sometimes that may make the child think, well, I can't do this, I can't do that because of my sickness. And some will grow up not wanting to venture out and not being able to become independent. Both, both. The question was, have we seen parents who are overprotective and smothering the child, not giving them a chance to live life and experience life because they have a sickness, because they have a chronic condition? And your response is,
I've seen both. I've seen some parents that will leave their child at the hospital at 13 and let them have flexibility to do some of their things on their own, figure out, how they talk to the doctors, how they handle their schoolwork on their own. And I've seen also parents that will smother their children, I would say, and feel like they have to coddle them and do everything for them, feed them. Even 15, 16 years old, they're still doing everything for them. And I've had patients where I see them now at 21 and they can't do anything for themselves. And those are the patients that I feel are in the hospital the longest
yes,
because they're frustrated at home. They're feeling like they're not being treated as an adult and they're not able to make their own adult decisions as to how their pain crises are being treated. They feel like the doctors and their parents are not understanding their pain and what they're going through when they know their body the best. And their parent is telling them, no, 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 this is what you're going through. And they're answering the questions for the child
right.
or the young adult. So I've seen both sides. And then that's when you have to remind the parent, okay, mom or dad, this young adult is able to answer for themselves. Or when it's a child that is younger, you have to say sometimes, mom, you have to step in and assist.
Right.
So
And that's the
we're gonna
reason the
take- they're all different.
social workers as part of the team allow us to give the best the best direction for those parents and for those children. I think in the transition, if we mention the transition model to the parents when the children are young, it would support them. We know you're nurturing, but we want to do everything we can to make this patient independent and functioning once they get to adulthood. You know, we hear it all the time, and as pediatricians, that we are coddling the patients, nurturing, smothering as doctors and providers, and that when they get to the adult world, they're just completely lost and don't have, um, they're not tough enough to handle the adult culture, the adult atmosphere. And I think it's a balance. We are pediatricians, and that's what we do. We are the nurturing ones, but we should recognize that there's a transition, there's a crossover, there's a bridge, and we should be preparing our patients to be as functional and as independent as they can once they get to that young adult age. Mr. Rubin, I wondered if you had questions for me or um, uh, our medical perspectives, I guess, that you wanted to share with us, or any comments about the transition process. Again, I can't celebrate enough that you've been able to maneuver with sickle disease your whole life, and you are just a just a model of how motivation and how mental attitude can make you. I wish you could talk to our patients, some of our patients who are 20 years old, and
Anytime.
they are lost, and their whole life is consumed with pain. I hurt every day, and I believe they do. But at the same time, we have to figure out a way to live with that chronic pain. It doesn't keep them from walking around and functioning, but it takes all of their thought, and they don't have goals for working or doing anything. My favorite question to ask patients is, what are you proud of? Every day I see patients, I ask, what are you proud of today? And especially the ones who are complaining of pain so much, whose lives have just been turned around, and they don't seem to have anything to celebrate. And I'm trying to let them know they do have something to celebrate, even though they have no control over their medical condition. But the way you deal with your chronic condition, you do have control over that part. And that's what we're hoping to develop together, especially in those young adults that are on that chronic pain path and that take medication every day, go to the ER every week, be in the hospital every month. That we can still encourage those patients that they have lives that are valuable. They're lucky to be living, they're lucky to be here, and that we don't have to let pain just take over and completely consume us. But um, I just wondered if you read with that.
I I I totally agree with that. Um, proud of
What are you proud of?
all my accomplishments. I'll put it like that, and those that are yet to come. Uh, waking up every day, that's a plus. Waking up past 9 to 12 is a plus. Being able to not just go to college, but finish, that's a plus. Any accomplishment that you've made, no matter how great or small, that's a plus. Um, especially when you've been written off a long time ago.
Yes. And that plays on patients' minds, the relatives and the friends and neighbors, whoever knows you have a chronic condition, they'll say, "Oh, I heard
Hmm.
you won't live to past 20, you won't live past 12, you won't live very long." And that puts a tremendous pressure on young people to try to say, now, not all of them are like you that said, "I'm going to do everything I can for as long as I can,
Right.
as quickly as I can." But there's some of them are dwelling on it to say, "Well, there's no reason for me to get up today because I'm not going to be here tomorrow or next week or next month." And that's the saddest part for me, is to hear them that they're
Giving up.
already given up,
Yeah.
and they're just really at the beginning of their young lives.
Right.
But listen, we are making progress to where patients live longer. You were ahead of the game, but the ones behind you should be living longer with the interventions that we do have now,
Right.
and the focus that's been placed on the quality and the character of life for sickle cell patients.
Man.
I think we're at the end of our discussion. I thank you, Mr. Reuben Buford. You've been an amazing person to interview. I've enjoyed every minute talking with you. I hope our audience has found you as interesting and as enthusiastic and as encouraging as I have found you. And we appreciate your sharing your life experiences with us.
Oh, thank you, ma'am.
It's
Thank
been,
you for everything
it's
that you
been
do.
wonderful.
Yes, ma'am.
Thank you so much.